Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, clinical features of acute suppurative thyroiditis. So, clinical features of acute thyroiditis or acute suppurative thyroiditis, because it is an acute condition, thyroid pain is seen, which is referred to this thyroid pain which is seen in most of the cases, it is referred to the ear and throat, and you can also see a small tender goiter is also seen. The patient will present with fever, dysphagia, and erythema is seen over the thyroid. Then there can be systemic symptoms can also be seen, like febrile illness and lymphadenopathy may be seen. Similarly, these are the main clinical features of acute suppurative thyroiditis. Then what about the complications? So in the complications of acute suppurative thyroiditis, the patient can have systemic sepsis. Thus the infection from the thyroid gland, because of its extensive blood supply, it can travel to other parts of the body, resulting in systemic sepsis. It can travel to esophagus and trachea, causing tracheal and esophageal rupture. It can go to the jugular vein, causing jugular vein thrombosis. It can go to the larynx, resulting in laryngeal chondritis, or there can be infection of the perichondrium, causing perichondritis, and sympathetic trunk paralysis can also occur. Now, how are you going to diagnose the condition with acute suppurative thyroiditis? In acute suppurative thyroiditis, one important thing is the ESR and WBC are raised. But if you see, the thyroid function tests are normal in the acute suppurative thyroiditis. So here we have to do an FNAC for diagnosis. ESR and WBC are raised with FNAC. Biopsy shows that there is infiltration of polymorphonuclear leukocytes in the thyroid tissue. If you see that these polymorphonuclear leukocytes are seen, then you can diagnose the patient. Culture can be done mainly to identify the organism. We can do culture, and if the patient has persistent pyriform sinus in the children. If there is persistent pyriform sinus in the children, then always suspect about recurrent acute thyroiditis. Then what about the treatment of acute suppurative thyroiditis? Acute suppurative thyroiditis, because it is an infectious condition, first and foremost you should do parenteral antibiotics should be given to the patient along with the drainage of abscess. Parenteral antibiotics are given with drainage of abscess should be done. And if the patient has persistent pyriform sinus, has already said, now in persistent pyriform sinus we have to do a complete resection of the sinus tract is very important, along with the area that the tract communicates. So you should resect the tract, and you should also resect the area of the thyroid tissue to which, like for example, if this is the pyriform sinus and if this is the thyroid tissue, if this is communicating here, you will have to remove the thyroid, you will have to remove the pyriform sinus, and you will have to also remove the part of the thyroid which is in relation to the pyriform sinus fistula or pyriform tract.
thank you and thank you for watching.